For over 15 years, I sat across from patients who did everything right. They brushed twice a day. They flossed every night without fail. They came in for professional cleanings every 6 months like clockwork. And yet every single visit, something was off. Gums that were still inflamed, enamel that was still wearing down, sensitivity that hadn't gone away, a persistent bad breath that no amount of mouthwash seemed to fix. And one day, after years of seeing the same patterns repeat themselves, I stopped and asked myself a question I had never asked before. What if we've been treating teeth the wrong way the entire time? My name is Dr. Joseph, and I've spent the better part of 2 decades studying not just dentistry, but the biology behind why teeth fail. And I'm going to be honest with you today in a way that most dental professionals aren't trained to be. Because what I discovered slowly through years of observation and late nights reading research papers changed the way I practiced dentistry entirely. It was a Tuesday afternoon when I was reviewing the files of 12 patients I had seen that week. 12 different people, different ages, different lifestyles, different diets. But when I laid out their charts side by side, something strange jumped out at me. All 12 had the same complaints: sensitivity, gum inflammation, early enamel erosion, persistent bad breath, and all 12 of them had something else in common. They were all following their oral hygiene instructions perfectly. I had been giving those same recommendations for years, and the same patients kept coming back with the same problems, year after year, almost like clockwork. I started thinking about something I'd learned in dental school but largely set aside in clinical practice: the oral microbiome. The ecosystem of bacteria, fungi, and microorganisms that live inside every human mouth. We tend to think about bacteria in the mouth as something to be eliminated. You brush to remove bacteria, you use mouthwash to kill bacteria. But the science tells a completely different story. Not all bacteria in your mouth are trying to hurt you. In fact, some of them are the reason your teeth are still standing. And when we destroy them through overly aggressive hygiene, through the food we eat, through stress, through certain medications, we don't just clean our mouths, we open the door to something much more dangerous. Your mouth contains over 700 different species of bacteria, and at any given moment, the balance between those species determines almost everything. Whether your gums bleed, whether your enamel holds up, whether your breath is fresh or foul, and whether the rest of your body is quietly suffering from a fire that started in your gums. Think of your oral microbiome like a garden. A healthy garden has diversity. Weeds exist but are managed. The ecosystem is balanced and sustains itself. Now imagine someone dumps a bucket of bleach on that garden every morning and every night. Kills everything. The weeds come back first because they always do. They grow faster, adapt more quickly, and have fewer competitors. Suddenly the garden isn't a garden anymore. It's a monoculture of the most aggressive, destructive organisms available. That's what chronic overuse of antibacterial mouthwashes does to your oral microbiome. That's what a high-sugar, highly processed diet does. That's what chronic stress does, because stress elevates cortisol, which directly suppresses your immune response and allows inflammatory bacteria to thrive. The bacteria that thrive in a disrupted oral microbiome are not gentle tenants. Species like Porphyromonas gingivalis produce toxins that directly attack gum tissue. They trigger an inflammatory response that is, at first, entirely silent. You don't feel it, you don't see it, there's no pain, but under the surface, your body is mounting a defense. And that chronic low-grade inflammation costs your body an enormous amount of resources. Because I'm not just talking about gum disease, I'm talking about your heart, your lungs, your brain, your immune system. Multiple large-scale studies have found strong associations between chronic oral inflammation and cardiovascular disease, type 2 diabetes, Alzheimer's disease, and even certain cancers. This is not fringe science. This is peer-reviewed, published, replicated research. Your mouth is not a separate system. It is the entry point to everything. When most people hear the word probiotic, they think about digestive health. But there are specific strains of probiotic bacteria that have been shown in clinical research to dramatically improve the health of the oral microbiome. Studies have shown that certain lactobacillus and streptococcus strains, when introduced to the oral environment, can actively compete with and suppress the growth of pathogenic bacteria. These beneficial bacteria produce antimicrobial compounds. They create an environment hostile to the pathogens we worry about. They help regulate the pH of the mouth, which is critical because an acidic oral environment is one of the primary drivers of enamel erosion. And they help reduce the inflammatory signals that are silently taxing your immune system day and night. I started incorporating this understanding into my practice, and over months, I began to see differences I hadn't seen with conventional interventions alone. Less bleeding on probing, reduced pocket depths, patients reporting fresher breath, some even noticing less sensitivity. We have been treating the mouth as a sterile zone to be maintained, when it is actually a living ecosystem that needs to be supported. And that shift in understanding changes everything. One of the most common things I hear from patients, especially those in their 40s, 50s, and beyond, is some version of this sentence. I know my teeth are getting weaker. That's just what happens when you get older, right? And I want to challenge that assumption directly. What is actually happening, in most cases, is a gradual, cumulative process of mineral depletion that has been going on for years, possibly decades. Your tooth enamel is the hardest substance in the human body, almost entirely composed of a calcium phosphate compound called hydroxyapatite. And enamel cannot regenerate itself. Once it's gone, it's gone. However, enamel can be remineralized. If the conditions in your mouth are right, minerals from your saliva can actually be deposited back into slightly damaged enamel, strengthening it. But this only happens when the pH of your mouth is balanced, when you have adequate levels of calcium, phosphorus, and vitamin D in your system, and when your oral microbiome is healthy enough to support that process. Enamel erosion isn't just about what you put in your mouth, it's about the entire state of your body. Vitamin D is perhaps the most underappreciated nutrient in dental health. It plays a direct role in the production of antimicrobial peptides in the mouth, helping your body fight off the very bacteria that cause gum disease and tooth decay. Global vitamin D deficiency rates are staggering, with some estimates suggesting over 40% of adults worldwide are deficient. Then there is magnesium, involved in over 300 enzymatic reactions in the body, including many that relate to bone and tooth mineralization. And vitamin K2, largely absent from modern diets, plays a critical role in directing calcium to where it belongs, bones and teeth, and away from where it doesn't belong, blood vessels and soft tissue. These are not exotic supplements. These are foundational nutrients. And widespread deficiencies in them have measurable impacts on dental health. Your mouth and your sinuses share physical space. The roots of your upper teeth sit extremely close to your maxillary sinuses, the large sinus cavities on either side of your nose. When there is chronic inflammation in the upper gum tissue, when the microbiome of the mouth is dominated by pathogenic bacteria, those bacteria and their inflammatory byproducts can travel through the tissues into adjacent structures. This is well documented in dental literature, the phenomenon known as sinusitis of dental origin. I had a patient who had suffered from chronic sinus infections for over 7 years, been on multiple rounds of antibiotics, evaluated by multiple specialists. She came to me for a routine cleaning, and I noticed immediately that she had significant gum disease on her upper molars, completely painless and invisible without proper instrumentation. We treated the gum disease, introduced a microbiome support protocol, and within 4 months she told me she had not had a single sinus infection. The connection is real. Now let's talk about the gut, because this might be the most surprising piece of all of this. Oral health problems very often begin somewhere else entirely. They begin in the gut. Your digestive tract is one continuous organ, and it begins at your lips. The microbiome that lives in your gut and the microbiome that lives in your mouth are in constant communication. They share bacterial species. They respond to the same dietary signals. They are affected by the same stress hormones, the same medications, the same nutritional deficiencies. Research has shown that people with significant gut dysbiosis are significantly more likely to have concurrent oral microbiome dysbiosis. The two influence each other, which means that if you are treating your gums and your teeth without addressing the health of your gut, you are fighting with one hand tied behind your back. I had a patient in his mid-30s with aggressive early-onset gum disease. We did everything by the book. Then I referred him to a functional medicine colleague who found significant small intestinal bacterial overgrowth and severe deficiencies in vitamin D and zinc. We treated the gut, addressed the deficiencies, and over the following year, his periodontal condition stabilized in a way I had honestly not expected. His gums stopped bleeding. His bone loss halted. His breath cleared. What changed was the internal environment his body was working with. Your immune system is not an infinite resource. When it is chronically engaged, constantly responding to bacterial toxins leaking from inflamed gum tissue into the bloodstream, it has fewer resources for everything else. Your energy suffers. Your cognitive clarity can suffer. Your body's ability to fight off infections is diminished. Your sleep quality can be affected because inflammatory cytokines have complex effects on sleep architecture. And all of this can be happening silently, without a single dramatic symptom that would make you think, "This is my gums doing this to me." I've had patients describing a pervasive, unexplainable fatigue, a feeling of running at 60% capacity, waking up tired, needing 3 coffees to function by mid-morning. When we took a comprehensive approach, addressing the oral microbiome, correcting nutritional deficiencies, and reducing the inflammatory burden, multiple patients reported improvements in energy and general well-being that surprised even me. How much of your daily tiredness, your brain fog, your low-grade sense of depletion might be connected to something happening in your mouth right now? The way we've been taught to think about dental health is transactional. You have a problem, you get it fixed, you leave the office. But health is not transactional, it is ecological, it is dynamic, it is a living system that requires ongoing informed attention. I've watched patients in their 50s develop healthier gums than they had in their 30s. I've watched people who had been told they needed multiple extractions stabilize entirely, not through expensive new procedures, but through fundamental shifts in how they supported their body. The shift is not in doing more. The shift is in doing differently. Your teeth are not just cosmetic. They are not just functional tools for chewing. They are, in a very real biological sense, a reflection of your overall health. Their strength, their color, their resilience are downstream expressions of how well your body is managing inflammation, mineral metabolism, microbial balance, and nutritional adequacy. When you improve those upstream conditions, your teeth respond. Slowly, yes. There is no overnight transformation here, but steadily, measurably, in ways that compound over time. Reduced gum bleeding after consistent microbiome support. Improved enamel resilience as mineral levels normalize. Clearer breath as pathogenic bacteria lose their dominance. Better sleep as the inflammatory burden on your immune system decreases. And when you reduce the chronic inflammation that is silently taxing your system, you free up biological resources. You don't just have a healthier smile. You have more of yourself available to live your life. I am a dentist, and I'm not asking you to abandon your dentist. Keep your professional cleanings. Keep brushing and flossing. Mechanical hygiene is a foundation, and nothing I've said today is meant to replace it. What I am saying is that the foundation is not enough on its own. The conditions, the microbiome balance, the mineral nutrition, the systemic inflammation level, the gut health, these are what determine whether that structure holds up over a lifetime. We started this video with a question I asked myself after years of observing patterns I couldn't explain with conventional dental logic. What if we've been treating teeth the wrong way the entire time, after everything we've covered today? The oral microbiome, the bacterial balance, the connection to systemic inflammation, the role of minerals in nutrition, the gut-mouth axis. I hope you can see that this wasn't a rhetorical question. It was the beginning of a different way of thinking, a more complete picture of what oral health actually is and where it actually comes from. Your mouth is an ecosystem, your body is a system, and the health of one is inseparable from the health of the other. Healthy teeth are not a luxury reserved for people with perfect genetics or unlimited dental budgets. They are a biological possibility for anyone willing to support the underlying conditions that make them possible. That's the real work of oral health, and it is entirely accessible to you.